Animal Health Surveillance System, and the District 12 Director of the American Association of Bovine Practitioners, and I will be your moderator this evening. Bonjour à tous et bienvenue à ce webinaire parrainé conjointement sur l'influenza aviaire hautement pathogène sur les bovins, édition canadienne. Je m'appelle Murray Gillies, je suis coordinateur du système canadien de surveillance de la santé animale et le directeur du district 12 de l'Association américaine des praticiens bovins, et je serai votre modérateur ce soir. So a couple of housekeeping items. We want everyone to be comfortable with all the functions of Zoom in this webinar. So this will be a 1.5 hour webinar with 30 minutes at the end for Q&A. Recording will be made available after the webinar. The chat functions are disabled, and we ask that everyone keep yourselves on mute. And we want you to type your questions in the Q&A box found at the bottom of your screen. But just pay attention because that Q&A box may possibly be located in the 3 dots menu on the right-hand side. Donc, pour les détails, ce webinaire dure duration de 1h30 avec 30 minutes pour les questions en fin. L'enregistrement sera disponible après le webinaire. Les fonctions de chat sont désactivées et s'il vous plaît, se mettre en mode silence. Tapez vos questions dans la boîte de Q&A et faites attention. The boîte de Q&A peut être dans le menu de 3 points en droite. We're pleased to offer this webinar with live translation. There will be translation in English and French. You can access your language of choice by clicking on the interpretation globe at the bottom of your screen. Ce webinaire a la traduction en direct, anglais et en français. La langue sera communiquée avant la présentation de chaque orateur. Pour sélectionner votre langue, s'il vous plaît, appuyez sur le bouton d'interprétation en bas de l'écran. We're also pleased to offer bilingual screen sharing. To select the slides that you are viewing, please click on the green View Options button at the top of your screen. Nous sommes heureux d'avoir un partage d'écran bilingue. Pour sélectionner les diapositives dans votre langue de choix, s'il vous plaît, appuyez sur la barre verte au supérieur de l'écran. Just so everyone knows who CAS is, we're a division of Animal Health Canada, and we support the surveillance pillar. We work in a network of networks, and how this works is that each individual node on the image on your screen represents a network, and they all feed information into CAS, which can then disseminate that information to all the networks in order to streamline initiatives and avoid duplication of efforts. Not only are we using this platform to share information in a decentralized way, but we are sharing new disease events, signals of interest, resources, and events that are happening relevant to animal health. We also share lessons learned from research projects and programs from across Canada and provide a platform for people to bring questions to Canadian experts. Pour que tout le monde sache qui est CAS, nous sommes une division de la santé animale Canada et nous soutenons le pilier de la surveillance. Nous travaillons dans un réseau de réseaux. Chaque node individuel représente un réseau qui partage d'informations au CAS, qui peut ensuite diffuser ces informations à tous les réseaux afin de rationaliser les initiatives et d'éviter la duplication des efforts. Non seulement nous utilisons cette plateforme pour partager des informations de manière décentralisée, mais nous partageons également les nouvelles maladies, les signaux d'intérêt, les ressources et les événements qui se produisent dans le domaine de la santé animale. Nous partageons également les enseignements tirés des projets et des programmes de recherche menés dans tout le Canada, et nous offrons une plateforme permettant aux gens de poser des questions à des experts canadiens. So we work together to share resources between our sister networks. You can send
réseau. Vous pouvez envoyer des ressources
as network pages. Nous travaillons ensemble pour partager les ressources entre nos réseaux frères. Vous pouvez envoyer des ressources publiques et nous pouvons mettre à jour notre page de réseau. And finally, I'd like to say a big thank you to our many partners and collaborators on this webinar. You can see all of their logos on this slide. Un gros merci à nos partenaires et collaborateurs pour ce webinaire. It took great effort to bring this together, and we're really excited that you could all share it with us today. And so with that, it gives me great pleasure to introduce our first speaker, Dr. Fred Gingrich. Dr. Fred Gingrich graduated from the Ohio State University College of Veterinary Medicine in 1995. He was in private dairy practice for 2 years in California, and then a mixed animal veterinarian and practice owner until 2016, when he accepted the position as executive director of the American Association of Bovine Practitioners. Many people on this call will recognize Fred. I do a lot of work with Fred in my role as District 12 Director on the Board of Directors for the AABP. And Fred has been front and center of this issue since it began, and we're really pleased that he was able to dedicate some of his time to many of us who may be AABP members to provide this update today. So thank you very much, and take it away, Fred.
Thank you very much, Murray. Appreciate the opportunity. Good evening, bonsoir. It's been since I was in high school since I spoke French with any reasonable efficacy at all. So thank you all for joining. I have my contact information there on the screen. I'm going to answer questions at the end of my presentation, then I'll need to leave the webinar, but always feel free
devoir quitter le webinaire, mais
email and cell phone address. Text is okay too. So timeline of this disease event, early February is when veterinarians in the Texas Panhandle, which is kind of the northern part of Texas, which butts up right against Oklahoma in the middle south of the U.S., some veterinarians began noticing some unusual symptoms that appeared to be affecting multiple farms in their area. We have since learned from genomic sequencing of this virus, and there's a recent publication out that the USDA suspects that this single source event probably occurred somewhere around in December of 2023. In March, mid-March, AABP started having some conversations with members, and then a couple days later, we created a working group. That working group is AABP members, and it includes practicing veterinarians, academics, state animal health officials. Those would be our state veterinarian, diagnosticians, and industry veterinarians all have served on that group. It's about 40 people. And initially what that group did was share the clinical case description, because at that time it was unknown what the etiology was. But shortly after, and we also created a data reporting portal where veterinarians could input cases into that in a safe, protected environment. But then quite soon after that working group convened, March 25th is when the USDA announced the isolation of influenza type A H5N1. What is happening is that this virus, the novel host is a migratory waterfowl, and the virus apparently jumped from birds to cows. Many mammals have been affected worldwide. This is a global disease, but this is the first time it has been isolated in cattle, and some of the things that have been happening are driving some caution from the entire industry. Initial reports from USDA stated that there were no changes in the genetic sequence, and therefore there was no risk for mammalian transfer. However,
propagation chez les mammifères. Ceci dit,
veterinarians in the field believe that their clinical impression was that there was cow-to-cow transmission. So what does the disease look like in cows? Number one thing is that it acts very differently in cows versus birds. And birds, we're all familiar that it's high morbidity, high mortality. And at least in the US, the control mechanism is immediate depopulation of the affected flocks with disposal of carcasses. And the US has unfortunately depopulated probably about 83 million birds due to this disease outbreak, which began in the US in 2022. In cattle, however, it's a low morbidity disease. Many reports are in the 10% range, but some are up into the 15% range on animals that are clinically sick. There's essentially no mortality, although some secondary infections do result in mortality, such as severe pneumonia or mastitis, and there's no need for depopulation as animals recover. Some of you may have heard that AABP suggested a different name for this virus, And on one of our webinars, it was suggested this is not HPAI, and we agree with that. It acts differently, but there was a miscommunication from USDA, and we will use the name of the virus, which is influenza type A H5N1. There has been no reports in beef cows, young stock, or dry cows. That would be clinical illness. And Texas is our largest beef producing state in the US, and there's a large concentration of dairies in this area, as well as cow-calf ranches. But there have not been any reports in beef cows. There's been some testing done. None are positive that I am aware of, and that would be serologic testing. Affected cows have decreased appetite and ruminations. On herds that have rumen activity monitors, the first thing they notice is a lot more cows flagged by the computer. The manure is typically tacky due to dehydration. And then a hallmark clinical sign of this in cows is milk production decreases or completely stops in affected cows, and it will sometimes turn an abnormally thick yellow color, like colostrum. Again, they get secondary infections. Treatment is pretty much supportive care. But I think one of the things is that the dairies that have been impacted in the states thus far, many of them are large dairies.
Présent, dans beaucoup de cas, c'est des grandes laiteries, 4000 vaches, sinon plus. Et le
becomes overwhelming. The dairy in Ohio, on day 2, they had 770 sick animals, and that just really creates just a tremendous amount of stress and work for the animals and the caregivers. The number of cases seems to peak in about 2 to 4 days, and the disease runs its course over about 2 to 3 weeks. Herd level production losses are about 20%. My napkin math is it's about $100 a cow. So that dairy I just spoke of with 4,000 cows, the economic impact was $400,000 US to that producer. There's a very high emotional toll on dairy farmers, caregivers, and veterinarians, and that's one of the things that I have done in many of my media interviews is I do stress that although this is an economic disease, it's also mentally devastating to everyone involved, and we need to keep that in mind. Again, the working group activities you can see there, and I've discussed some of these, but we're really trying to create a safe space where we can discuss cases, share data, and develop resources. We've almost immediately developed a biosecurity resource, and we've had 4 really good webinars on this topic, and we're going to have another one next week. Those are for AABP members. The one next week is going to share some data about cereal milk sample testing 30 days before and then during the outbreak and after. It's a unique situation where that dairy routinely banked milk, and so the lab had samples that they could look back. Very good data there. So this is our webpage where if you click cow number 100 there, it'll take you to our H5N1 dairy disease outbreak page. Where are we today? 9 states confirmed. I think there's now 36 herds. There's some US dairy numbers for you. It just shows you the contraction in our dairy industry. I graduated in 1995. 100,000 dairy cows farms in the US, and currently there's about 21,000 with the same number of farms. So the dairy industry here, although we have a lot of small farms, most of the cows are on large farms. Certainly there may be other herds affected, and that's something that has been a significant challenge. And the number one reason that dairy farmers don't report this is, well, there's several reasons. Number one, they probably know what it is based on the clinical syndrome. Number 2, we have a situation where there is no federal funding for production losses in the US. If this virus gets in a bird and they depopulate, the government pays for all of the depopulated mortalities, not the natural deaths. And so it behooves the producer to immediately report. Unfortunately for this disease, there is no federal funding. And I believe that that is decreasing reporting and de-incentivizing reporting. And then the other thing is that there's a bit of a challenge with our labor workforce on dairy farms in the US. Most of it on large farms is immigrant labor, and they have a bit of a distrust issue there. And so that also creates a challenge as we're navigating this as well. Our message is pretty much the top two lines there. The FDA has completed studies on this, and it's, I think, 257 samples, variety of dairy products. You will find retail milk samples with PCR positive tests. That's the viral fragments, but there are no active live virus found in milk products, and we're very thankful for that resource from FDA to confirm that drinking pasteurized milk remains safe. So some things we know, and there's lots we don't know, and this changes, seems like daily. It pretty much only affects lactating dairy cattle. Today I did hear that there was some seroconversion in young stock, but there are reports from the field that even in heifer facilities across the road, they're seronegative. The dry cows, if they were dried off before the outbreak, they're seronegative. Heifers, seronegative. Go across the road to the dairy where they're affected. It's a clinical outbreak, and cows will seroconvert 5 to 7 days after. And so if you have an udder, you seroconvert to this disease. It has a tropism for the udder, concentrates in large amounts in the udder, and it's inconsistently found elsewhere. Even in positive cows, they will often be negative on nasal swabs, urine, feces. So we're pretty much seeing it in the udder. We have to focus on the milk when we're talking about human health risks because that's where the virus is. And so protecting employees, we need to focus on the milking technicians first, hospital crew, and the veterinary team, of course. Probably our highest risk right now is introduction of lactating dairy animals to the farm. But again, pasteurized milk is safe to consume, and the risk to the public is no. The other thing that I'll mention too, and I don't know if I put this in the slides, but the USDA FSIS, which inspects meat in the U.S., they have done some ground beef testing. They have not found any positive PCR tests in ground beef. They're doing some other call cow and slaughter facility testing of tissues and some more primal cuts. And then they're also doing temperature testing on ground beef patties that are spiked with virus to see what temperature that kills it in beef.
Qui a le virus, on intègre le virus et on teste.
We don't know. We don't really know how it's spread. There's suggestions that it could be a fomite spread via milk. Could it be aerosolized when cows are in the parlor? Birds. We still don't have a, could it be insects or flies or something like that? We still don't have a very good grasp on how it's spread, although there are a lot of theories out there. We don't have herd-based screening tools, although bulk tank sample validation studies are underway. We need validation for serology. We don't know if this virus is going to continue to change and become more pathogenic, which is what flu viruses do. We don't know if cows will be a constant reservoir for the virus. And we don't know if vaccination will be effective at preventing infection, transmission, or mitigate the clinical signs, milk loss. There are a lot of discussions right now about development of a vaccination for this for cows. We also have to consider trade issues, which is why that vaccine is currently not used in poultry in the U.S. What are some challenges we have? Cows move every day. It is common in the U.S. Due to labor and facility issues that many calves are not raised on the dairy. They're shipped to calf ranches, especially to the southwest portion of the U.S., Arizona, Texas, New Mexico, Colorado. Those states have pretty large calf ranches where they'll raise these, and the weather's real nice there. Heifers will move back to the dairy, and lactating cows move between premises routinely if there's a conglomeration of dairies that are sharing cows due to one owner. Cull dairy cows move to slaughter every day. We slaughter about 50,000 head of cull dairy cows in the U.S., and many of our states do not have a cull cow packing plant or a packing plant at all due to consolidation in that industry. So, for example, I live in Ohio, and every dairy cow in Ohio that gets slaughtered is transported outside of the state. So AABP is certainly supportive of safe movement. we're not supportive of just a blanket stop movement right now because of the health and welfare implications. What will we do with those calves if there's no way to raise them at the home dairy? There's no employees, there's no feeding equipment, there's no pens. Call cows, if we can't call them, you know, that's a big welfare issue there. And then there's certainly economic implications. So we do have a federal order down here. It only affects lactating dairy cows, and it only affects them if they're going across the state line. And so we've got some recent clarification on some of these. So dairy producers can move dairy call cows direct to slaughter across state lines. In every state here, they don't need to have a certificate of veterinary inspection or a health certificate because every state down here accepts an ownership or statement, which can be filled out by the producer, and there is no testing. If we're going to sell lactating dairy cows across state line to go to a dairy for production purposes, that requires a milk PCR test within 7 days and a health certificate. CVI is health certificate. We only have to test a maximum of 30 animals per group. So if you're shipping 500, they test 30. And that probably has some good epidemiologic standing just due to the way this virus moves through the herds. Movement from positive herds, there's still no clear guidance. USDA says they'll work with the state veterinarian and the producer to make sure that cows can go to slaughter. But we still don't know exactly how that's going to occur. USDA, I did ask them about cows coming down, from primarily the eastern provinces into the U.S. for dairy cow slaughter. Should not have further requirements, although some states do have import restrictions. The Livestock Marketing Association has state restrictions. And so if the state is more strict than the federal government, we have to defer to the states. And so I'd encourage you to look at the Livestock Marketing Association's website for those state restrictions. That's all I have. Thank you so much. And I'm happy to take any questions if there's time, Dr. Gillies.
Thanks, Fred. Always time for questions, and there's quite a few already. Start you off maybe with a simple one. What are some differential diagnoses for this disease?
Well, in the beginning, we really had no idea. Some people were hypothesizing that it was coronavirus because some of the herds did report episodic diarrhea, kind of like winter dysentery. And there were some animals that were positive. We encouraged people at the beginning of this to submit samples from clinical and non-clinical animals so we could have a control group. And then there was some concerns about a common feed source, but it really kind of smelled like a novel virus from the very beginning.
Thank you. Another question, any information on high-path avian influenza virus transmission to calves fed unpasteurized milk from an infected lactating cow?
So although we do not have good evidence right now that this impacts young stock, I think that would be a poor practice right now. We would not suggest feeding unpasteurized milk to anything. That includes farm cats. They have been affected, other animals on the farm. So that milk either needs to be disposed of or sold. If it's unsaleable milk, then it needs to be disposed of. And there's various ways you can do that. Interestingly, acidified milk feeding, which I learned at an AABP meeting from one of the presenters from Guelph, I think many years ago, this virus probably is destroyed at a low pH, but probably not where we're acidifying milk. So there are some studies looking at that.
Good. That leads into the next question quite well, too. Have any processors in the U.S. refused milk from infected farms?
No. No, not that I'm aware of. And they're not right now testing testing milk at the processor, since we know pasteurization destroys it. They are not doing that currently.
Have any beef cattle been tested at all for HPAI that you're aware of?
So I am aware of some serology testing, and that was all negative. But as far as wide-scale surveillance, no. If I was going to prioritize testing in the beef industry, I would first go to cow-calf ranchers. We're in calving season right now, and it should be wrapping up now. We should be, nursing season. So, that I think if it was in the beef industry, it potentially could be devastating, because if it's a 15% morbidity, that means 15% of your calf crop is at risk for nutritional, even death.
Heaps of questions. We'll try to get through as many of them as we can. You mentioned seroconversion in calves has now been documented. Was that surveillance testing from a positive farm?
I don't know. I just learned that a couple hours ago. Unsure.
Yeah, me too. Yeah. Yeah. Was there any recommendations or things being done for the handling of waste milk from positive herds in the U.S. dairies?
Yeah, that's a great question. And so, right now, what dairy farmers have to do is they have to follow their state regulations for milk disposal, especially if it's large quantities. So options for that are going to be discharged into a sewer system of some sort. Another option would be into the lagoon. Third option would be spreading, direct spreading on the field. The virus probably doesn't survive long in warm, sunny temperatures on a field. Unknown about a lagoon. It does like, wet, cool, dark environments. So that's why I think acidification studies would be useful, because maybe we could acidify that milk before it goes out, which could potentially infect birds or other species. Go ahead, Murray.
Is there an estimated incubation period for this disease in cattle?
We don't know, but what I can tell you is some data that I have seen shows that the virus is detected in the bulk tank anywhere from, about 21 days before outbreak, and it really drops to low CT values about 5 to 7 days before outbreak. So I don't know if that tells us the incubation period is around 7 days. We don't know.
And to follow up from that, the USDA case definition had talked about herd level incubation period. Do you have any information on what they're referring to when they're saying herd level incubation period?
No, I don't. I'm sorry.
That's okay. We didn't either, honestly. It's a new term for us. Couple more questions, and then we'll move on to our next speaker. You get a lot of engagement, Fred. And as he said, you can always reach out to him. He's pretty good with emails. When did the cats on farms die relative to time to disease in the cows?
I think it was at the same time as the outbreak.
Okay. That's a question. Maybe we'll do one more. Is the U.S. considering, because this has been talked about a lot, obviously, is the U.S. considering mandatory reporting at the farm level? I believe there's mandatory reporting for veterinarians, but could be wrong.
Yeah. So the way it works here is that you have to report a positive test. And so if the farm refuses to submit samples, there's really nothing we can do about that. When they do send samples in, any positive, so that's a PCR or serology test by a federal or even a private lab, must be reported with the sample submitted to our National Veterinary Services Laboratory for confirmation and sequencing.
Okay, thank you very much, Fred. If we didn't get to your questions, I'll touch base with Fred and we'll send out a full response sheet later on. We'll move on to our next speaker. So thanks again, Fred, for all your collaboration.
Yes, thank you all.
On the AAVP side, it's been greatly appreciated. The next presentation will also be done in English. And our next speaker is Dr. Cheryl Cardona. You may remember her from one of the previous AAVP webinars. Dr. Cardona is the Pomeroy Chair in Avian Health for the College of Veterinary Medicine. In addition to her expertise in avian influenza, Dr. Cardona is interested in zoonoses and the role that poultry play in human health and well-being. She also serves as co-director and co-principal investigator of the Secure Food System at the University of Minnesota. So please welcome Dr. Cardona. Take it away.
Thank you very much. So I'm going to talk about the One Health aspect of avian influenza, what has happened and why we should care. At the end of the talk, I'm going to give you my email address, and feel free to connect with me as well if you have specific questions. So I am a poultry vet, and so I'm going to talk to you a little bit about what I know about influenza and having seen it for many, many years over many outbreaks. So influenza or flu is a disease. So when we talk about flu, that's a disease, and it's caused by influenza virus. Bird flu, sometimes called in the popular press, is caused by influenza A viruses. Influenza A viruses follow several rules, and the reason I'm bringing this up to you is that control programs and anticipating what's going to happen with a flu outbreak are always going to be following these rules. So influenza A viruses can cause outbreaks. I'll go into each of these a little bit more. The virus itself, outside of a host, is fragile, except in moist and wet environments, as Fred has already said. In most hosts, most influenza A viruses cause a self-limiting disease that can spread and spread and spread. We'll talk about that too. Influenza A viruses mutate and change. That's a rule. It's not an option. It's a rule. And there are many hosts of influenza A viruses. And then I'm going to talk to you a little bit about why you should care about influenza A. So influenza A viruses cause outbreaks because they spread. So the R0, most of you probably know, but I'm just going to say it because, I'm a teacher and I love to say things over and over, even though it's boring, is a measure of transmissibility in a given setting for a species. So on the right-hand side of your slide, you can see several R0s for human epidemics that we've seen. So COVID had an R0 of between 2 and 3. That means that for every infected person, that person spread the virus to 2 or 3 additional people. What we know for influenza A viruses, that the R0 varies by species, both because the host has different susceptibilities, but also because of the setting that they're housed in. So broiler chickens have an R0 for avian influenza virus, HPAI, goose Guangdong lineage 2.3.4.4b, that is between 2 and 3. So for every broiler chicken that's infected in a house, 2 or 3 additional. So it's right about with COVID. In comparison, egg-laying hens have much higher R0, and that is partly why why we see more robust spread in them. So their R0s are between 6 and 11, so somewhere between a Zika and almost to measles. In comparison, turkeys are highly susceptible to infection and also are housed and watered, actually, frankly, in such a way that they have a very high transmission rate. And so R0 is between 20 and 30. At this point, we don't know what the R0 is in dairy cattle. We know that it spreads from cow to cow, but we would expect to see an R0, that might be different among different age groups or potentially among different breeds. This is not uncommon with flu. The flu virus is fragile because it's enveloped, but when it's outside of the host, and they cannot remain infectious for very long if they're exposed. And that's one of the reasons why we don't really talk about aerosol transmission. Airborne transmission for sure, because and often it's in droplets. But once it's in an aerosol, the virus dries out quickly and is going to not remain infectious, but in droplets or in a humid atmosphere for sure. So here's a list of disinfectants that don't work on influenza A viruses. Okay, that's all of them. So all disinfectants are going to work. However, the influenza virus survives in materials that keep them wet, cool, and protect them from light, like fecal material. So they tend to exploit the weaknesses in farm systems to stick around. And so your disinfectants that you use to inactivate this virus are all about following the rules of the disinfectant. Is it inactivated by organic material, etc.? So the flu virus is sensitive, but it knows where to protect itself somehow. So influenza viruses also change all the time, and they change in two primary ways. One, new viruses are created when one host, an individual host, is infected with more than one flu virus. This happens all the time in their reservoir species in ducks. So we
Chez, par exemple, les canards, on va peut-être voir un H5N6.
And one that would reassort and form this new H5N1. It will also form many other different subtypes, viruses with different characteristics, different genotypes that may express in different phenotypes. So you may wonder, could reassortment happen in cattle? Hard to tell. Cattle previously have been infected with influenza A viruses from humans, potentially from swine. That could serve as a source for additional genetic material. You could additionally see reassortment taking place if humans are infected. You could see reassortment taking place in cats if they're harboring more than one virus. We could also see viruses reassorting in ducks and making their way back into livestock species. So there's really lots of opportunities for change. It's just one of the rules of flu. The other way that influenza A viruses change is that every time they infect a new host, they change a little bit. And so we're starting to see that with cattle. And I believe over the projected 4-month time that they've been estimated to be in the United States, we've seen the emergence of up to 5 clades or subclades of this virus based on those changes. All right, so that means, you know, you're facing an unsteady target. And so those that unsteadiness means that new characteristics like different clinical syndromes may appear or variations in transmissibility. So right now, you know, we've heard that, you know, the lactating cow is targeted, but it could be, there could be a few changes that could easily happen that might put other age groups at risk. New sequences make detection tests less effective. So in the United States, and I believe in Canada as well, we're relying on matrix gene detection with our RT-PCR. And we saw after the 2009 pandemic that there were significant changes in the matrix gene. And so for a while there, our PCRs didn't work. In addition, we're using subtyping frequently with RT-PCR as well. So changes in those genes and that genetic material can definitely cause problems. In addition, we're unclear. I think we are pretty confident that any of the H5 genes in the 2.3.4.4b grouping would be protective from the for all of the subclades that we're talking about that have emerged from in all the species that we've seen in the last 2 years of this virus, but that could change as well over time. So genetic changes and the nature of flu just means that we have to continue to watch and continue to dig in and sequence a little bit and make sure that we're still on track. In other words, we cannot walk away from this. We can see new and more types of hosts. So I think this is an important thing to remember when we think about the history of goose Guangdong lineage viruses. They emerged first were detected in 1996. They then caused a big outbreak in Hong Kong, where we first learned in 1997 that they could be transmitted directly from birds into humans. There was stamping out was successful, but then we saw the virus come back in 2002, causing death and clinical disease in multiple types and species of wild birds. The virus was then again stamped out, suppressed, And it came back again in 2005, and we started to see it spread in migrating wild birds, and it spread across the Ural Mountains. So we've seen these kinds of episodes where the virus emerges, causes an outbreak, maybe in a single species. We've suppressed it, but probably not completely. It's emerged again in different ways, right? So targeting new and different species, and targeting or being able to infect a lot of species at one time. So I think that's kind of what we're facing at this moment as we look at infections in cats, the potential involvement of humans, of cattle, potentially of goats in Minnesota, and also of turkeys and chickens. So we're talking about a variety of hosts in addition to the other hosts that we have no idea about. So influenza is a self-limiting disease for some. Even though you might feel pretty bad when you get the flu, which is usually going to be an influenza A, you can recover and usually do. Cows appear to do so as well. As Fred mentioned, antibodies are a marker of recovery. Generally speaking, antibody-positive animals are not infectious. So we use antibody positivity in with low PathAI control methods in poultry as a risk reduction marker. And so I am going to strongly encourage that we use, that antibodies be removed from a reportable list. It's very important to begin to get antibody studies underway and be able to test for antibodies without having regulatory control. I don't think that they raise a regulatory risk myself. All right, a group can recover and stop being infectious if it is closed and isolated for about 2 weeks. That depends on the transmissibility, of course, of the infection. But one cow that will recover from influenza may be producing enough virus to kill about 1 million chickens every day. So therein lies the rub. And I think some of you are asking those questions before. Now, our poultry industry is used to living alongside a reservoir that's carrying a lot of virus, but our industry, our poultry industry, is not prepared at this time for that load of virus. So that is something definitely that is causing problems. Okay, so there are many hosts of influenza viruses. I think many people were surprised that cows came up on this list, but there are many other hosts that have been implicated in influenza. Are there any mammalian or avian species that are truly resistant to influenza? I'm not sure that that would ever be the case. Never say never with flu. So there are approximately 2,000 avian species in North America and about 1,000 mammalian species. We don't have a complete picture of all the hosts that are have influenza naturally and maybe have been exposed or have the potential to transmit influenza, H5 influenza A viruses back and forth between our domesticated species. That creates a real challenge for creating bioexclusion like we do for poultry. It creates a real difficulty in trying to manage and mitigate exposures. So although we don't know all we want to know about bovine influenza, we do know that it has to follow the rules of influenza viruses. So it is fragile outside of the host. It's a self-limiting disease. It will find more hosts. So we are very likely to discover there are more mammals, not fewer mammals, that are infected. We know that it can transmit from cows to poultry. We know that it can be controlled and that the animals can survive. So why should you care? Why should we care about this this disease? Well, for one, self-preservation. These are the mortality curves from the 1918 pandemic, considered the worst pandemic in human history. 2.5% of the human population was killed during that pandemic. And although I don't believe that that would happen again, because I think we are a lot better off, it is always better to stop it in animal species. And my veterinary pride tells me we should. We shouldn't wait for our public health colleagues to step in and take all the credit. So self-preservation for sure. Economics. So we've heard that cows can recover, but definitely they need supportive care to do so. And they definitely have clinical syndromes. So drenching cows, keeping track of those that are infected is definitely, and the movement controls that are needed is definitely an economic concern. And then finally, I think your legacy or our legacy, right? So I put an eagle here. We know that eagles are tremendously susceptible to infection, and it is fatal in many of them, although we do have a lot of serologic evidence that many of them have survived. But I put the eagle here because it's a charismatic host, and we heard about the walrus in the Arctic that was infected and died. And those charismatic hosts simply turn people away from having animals in agriculture, in my opinion. And you can see, despite the fact that these outbreaks are in cattle, you can see that most of the pictures that are shared about this are of poultry. And so it's a devastating disease in terms of reputation. So it's easier to say where H5 is not than where it is. Currently, it is not in Australia or New Zealand, or in Oceania, but it has been found everywhere else. Okay. So I think, these ideas of we're not going to vaccinate because of trade, we really have a major disease problem that we all are facing, all species, all continents. Isn't it time that we really should maybe work together to solve this? So these are some of the rules I tell the poultry veterinarians here. It's important to remember that we don't want to kill what you're trying to save. So we have to learn to live with this virus. We don't want to kill the milk industry. We don't want to kill the poultry industry by trying to preserve, trying to maintain things that we perceive but are not science-based. It's always better to end an outbreak sooner rather than later. It's better to end it when it's in animals that we know about than it is to end it when it gets to more and more species. And don't mistake monetary motivations for disease control strategies. They're not the same. As a veterinarian, I plead with you. Let's think about what we committed to do when we took our veterinary oaths. This can be solved for sure. Using the rules of flu, we could reduce explosive outbreaks in cattle using the terminology of our public health colleagues, flattening the curve so that they're not explosive, they don't put out as much virus, and prevent spread to poultry. I think vaccination is definitely something we should consider. And we have to remember that we're not going to get rid of the reservoir, right? The true reservoir are these wild birds. So, in terms of it coming back every year, yes, gonna happen. If you have any questions for me, we're going to wait till the end to answer questions, but this is my email, and I would welcome hearing from any of you. Thank you.
Yes, thank you. Carol is going to stick around, so we'll have panel questions at the end. And so with that, we'll move on to our next speaker. Just a reminder before we do, if you need to change the language for the interpretation, please select the language of your choice using the globe button at the bottom. And if you need to change the slides that are being demonstrated from French to English or English to French, use the green bar at the top, the View Options button, to select the slides. With that, we'll move on to our third speaker, Dr. Cathy Furness. Dr. Furness is the Deputy Chief Veterinary Officer for the Canadian Food Inspection Agency. Before joining the CFIA in November 2022, Cathy worked at the Ontario Ministry of Agriculture, Food and Rural Affairs in the role of Lead Veterinarian for Planning and Preparedness since 2013. And in July 2019, Cathy was appointed to the role of Chief Veterinarian for Ontario. So please welcome Dr. Cathy Furness. Take it away, Cathy.
Thank you so much, Murray. And good evening, everyone. Thank you so much for the opportunity to be here tonight. I'm not actually going to present.
En fait, je ne vais pas vous présenter
my talk very short so that we can move on to the presentation from my colleague, Dr. Jen Toupin. But I thought, and Jen and I felt that it would be a nice idea to have a little bit of an update on some of the activities of the federal and provincial and territorial partners in how we are planning for and preparing for responding to high path AI in dairy cattle. So within the agency, I do have numerous roles supporting One Health files, emergency management, but one of the most interesting and engaging roles that I have is participating as a co-chair of the Canadian Council of Chief Veterinary Officers. And I'm very fortunate to have a co-chair, provincial co-chair in Dr. Nicole Wanamaker. So we wanted to provide some updates today on some of the work and collaboration that we have ongoing at the federal and provincial territorial chief veterinary officer level as we're navigating and planning for a detection of high path AI in cattle. The CCVO, it consists of the provincial and territorial CVOs, as well as the CVO for Canada and myself. And we also have representatives from the Public Health Agency. And our objective is really to provide guidance and advice to support animal health and welfare issues within Canada. And we take a One Health approach and work with our partners to protect the national herd. So as you are all aware, for about the past 2.5 years, we've been responding to high path AI in domestic poultry. During this time, while there's been a lot of challenges, we've also had some big successes, including developing many of the strong partnerships with our PT colleagues that support a response to high path AI. So this has included working together on information sharing, joint communications, and sometimes even shared responses on the ground. And we've been able to take this model and very easily transition it to our planning and preparedness work for high path AI in dairy cattle. So the CCVO, we've been meeting regularly since the end of March with a specific focus on high path AI in cattle. And this has included various activities, including awareness building, discussions on disease reporting, planning to support producers and veterinarians with recommendations for biosecurity, testing, animal movement, as well as plans for engagement with our public health partners. The response to a reportable disease like high path AI in poultry or African swine fever in swine, it's relatively clear-cut. There are regulatory responsibilities and international trade obligations that enable federal and provincial partners to have fairly clear lines of authority. But responding to a disease like high path AI in cattle that's emerging is much more complicated. So taking this partnership approach and developing guidance and recommendations together, we can work with one another's strengths and we can support each other during challenges. And this is how we've been approaching this situation. So some of the examples of how we are partnering include, we have numerous working groups that pull on expertise from both the federal and provincial level. And we provide input on shared responsibilities, such as things like epidemiological investigations, implications to animal movement restrictions and biosecurity recommendations. We've really taken a collaborative approach in developing documents and providing input on guidance documents, decision records, and processes. We're making sure that our guidance documents reflect both federal and provincial regulatory requirements where we can. And we're also providing joint opportunities for partnering for information sharing and communication, both within government structures, but as well with our federal or national and provincial industry partners. And we're also working to support a national consistency where we can for public health recommendations and working with our public health partners. So much of the work and recommendations that Geneviève will be talking about shortly have included involvement from our CVOs from across the country. And I think with that, I'd wrap up, and I'd just like to do a big shout out to my PT colleagues for all their efforts in the continued collaboration and support as we're navigating this unknown territory. And with that, Marie, I think I can turn it over to Jen.
Thank you, Cathy, for that update. And so the message that we've gotten from the CVOs for those on this call is don't hesitate to reach out to them. They're there to help you. They don't bite, so please feel free to reach out to them if you have any questions regarding provincial responses to this virus. Please reach out to your CVOs. So with that, I'm going to introduce our next speaker, Dr. Geneviève Toupin. Jen, who I'll refer to from now on, will be presenting in French. So once again, if you'll need to switch your interpretation over to English, and you'll need to switch your slides over to make sure you're on the right language for interpretation and the right slides for you. So with that, I will be switching to French as well to introduce Jen. So Dr. Geneviève Toupin, a graduate de la Faculté de médecine vétérinaire
from the Veterinary at the University of Montreal. She worked in private practice for almost 10 years before joining the Canadian Inspection Agency as a district vet.
Ensuite, devenir agent de programme
and became a program officer when it comes to disease control in the Quebec region. She joined the General Policy Management and Program as a specialist at the national level to the veterinary program responsible for disease, and since 2022 as a national manager when it comes to programming for Jen, take it away.
Merci beaucoup, Marie.
Well, thank you very much, Marie. Good evening, everyone. Well, first of all, thank you for all of you to invite me here. It's rare that we have an opportunity to present in French, so I'm very pleased to be able to do so. So, let's begin. Next slide, please. This evening, I'll give you an overview to give you an idea of the Canadian perspective for sample submission and testing. Also, I will talk about biosecurity recommendations. I'll also look at the idea of movement controls on farm and trade implications if we did have some infection. And also, I'll talk about food safety.
Next slide, please. I thought that I would deal with the elephant in the room right from the get-go. So what I wanted to say is that everybody involved in the preparation of detection of HPAI, so, knowing that these are producers and vets, they want to know what's coming if the virus is found on their farm. Unfortunately, the answer is not that simple. It's a situation that continually evolves. And when we've got emerging diseases, what that means is that the information available for decision-making is not around, but we have to continue to move forward. So, like my colleague was saying, the CFIA, in partnership with experts from provinces and territories and from the industry and from the academy, have developed, so over the past few years, a decision-making analysis plan to be able to understand who does what and what CFIA needs to do when there are issues around animal health. What that means essentially is that we can no longer have the same approach as several decades ago when it comes to saying that the federal government will take care of everything. Resources are limited now, and we basically have to adjust all of our approaches based on the situations that we have. And we have a tool with three very important sections. Either the risk that the disease has as a threat to animal health, human health, and commercial exchanges. Next slide, please.
Donc, comme ça a déjà été mentionné par
As was
orateurs
mentioned by my previous colleagues, measures of intervention measures that we use in Canada, once we detect HPAI in cows, will differ from the ones that we are currently applying for domestic birds. So the virus is similar, but cows react differently to this virus. So as we said, HPAI is quickly spread and causes death amongst birds. Now, this situation causes big risks for bird health, but also when it comes to trade and all poultry. The symptoms in cows are lighter, given that the herd is not affected everywhere. And within 1 to 3 weeks, the cows develop symptoms, as Fred mentioned. At this time, we do not have any deaths, cow deaths, and the implications on cows and their products, the impacts have not been by any stretch of the imagination to the same scale as for birds and poultry. So the HPAI in cows, the role of CFIA currently is to say we have scientific support, we support diagnoses, and we will do international reporting. Now, I also mentioned, or it's worth mentioning, that we don't, or I did mention earlier, that this is not a simple response, basically what do we do on the farm? I've got a picture here on the screen that you can see. It's been up there for a few seconds now, but we've got the cow at the center, we've got milk, it's safe in Canada because of pasteurization, but obviously, as Carol said previously, the virus, so influenza A virus, could always mutate and turn into a different virus. So there's always a risk for human health. The more humans are are exposed to influenza A, either through birds and now through cattle, well, the more there is a chance that there are mutations of this virus. And at the moment, we've got, the experience of the pandemic that is just in our rearview mirror. So in collaboration with provinces and territories, and along with Human Health Canada, we have to take consideration all factors. We export products. We need to know what the impacts are on beef cattle, not just cows, not just dairy cattle. We need to understand how infections go back and forth between birds and cows. And we also, this virus has killed some cats on the farm as well. So it's not negligible because we know that humans could be in direct contact with cats and poultry. So, anybody who has a small hen house at home or that sort of thing, all those birds could be at risk. So we do need to develop a strategy. Next slide. I'm going to go through this quickly because this was already mentioned by Fred, but what do we need to look at? What do we need to look at? So when we look at things, we say, okay, what are the cows that are at second lactation? Perhaps the cows are older. What we look for is sudden decrease in milk, thicker consistency in milk. Generally speaking, it's not just a question of mastitis. There's no signs of, or few signs of mastitis so far. A decrease in feed consumption, a drop in rumen motility, dry manure or constipation. Diarrhea has been seen in cows. Some have fever, not all. But one of the factors that could sort of raise flags is that there is a history and this is all in the regulations on the website, is that if there's a history of either dead wild birds on the property or birds that have been in direct contact with water or food sources. And when that happens, we can add cats who have neurological symptoms or who die. Those are other factors that need to be taken into consideration when we assess the risk of this virus. Next slide. So what can veterinarians do? Given that HPAI in Canada is considered a mandatory declaration, if it is suspected in a cow, somebody needs to contact the local district office of the CFIA. At that point, the chief veterinarian officer from the province, because in some provinces, the disease is a mandatory declaration. If there's a clinical presentation that we expect and there's no other diagnosis that's possible in this situation, as I said, if you discover dead animals on site, is there a possibility of contamination? Have wild birds contaminated the feed or water? Those are things that are on the radar. And there's also recent introductions of other animals into the herd, especially if these animals come from the US. Next slide, please. Now, unfortunately, these slides are not translated into French. I only got them today, so I didn't have a chance. They were published on the American CDC site, the Center for Disease Control in the US. I just got them today, these slides, so I didn't get a chance to translate these, but basically these are methods of spreading. So they are part of the study. They have not yet been confirmed. At this point, we believe that it is wild birds that are the first case of transmission, and after that, the transmission carries on to other farms through animal movement, through other herds. These animals, they are potentially asymptomatic animals who are displaced at the time, and then they become symptomatic. Even though there isn't a direct link between animals, we think there's lateral transmission that does take place between passive vectors. So milking equipment, for example, boots, clothes, hands, all of those objects will play a role in animal transmission. Next slide, please. HPAI, like the virus in wild animals, can it be a risk to humans? Well, in Canada, we have never reported a locally acquired case of HPAI in a human, and Public Health Canada considers that the risk of transmission remains low for humans. Those who are in contact with animals, including cattle and animal products, could, if those animals have the virus and if they are highly contaminated, humans should take additional precautions to protect themselves by wearing personal protective equipment. So face masks, goggles, gloves, coveralls, and boots. If boots and coveralls are reusable, then they need to be entirely washed and disinfected in between farms. Masks and gloves that are disposable should be disposed of on the farm where they were used. If animals are infected and exposed, if they are in an area that is contaminated, then there are ways of intervening. It's on the Public Health Agency of Canada, and it's in partnership with the Canadian Centre for Occupational Health and Safety. You can go to that website as well, and you can see how you can protect yourself from avian influenza A. If ever you're interested, the links are in the presentation here. Now, biosecurity. Next slide, please. To prevent exposure and propagation of HPAI in cows, producers and vets should continue to follow good biosecurity measures, such as those in the National Biosecurity website on the CFIA website. dairy producers who need to look at biosecurity. They all subscribe to ProAction with the Dairy Farmers of Canada, and so there are ways of finding best practices there as well. We're asking veterinarians to to apply the following things. So, for example, to prevent the introduction of the virus on a farm, please reduce reduce as much as possible access between cows and birds, and keeping the birds away from water and feed. If it's not possible to avoid that, well, then if new animals need to be brought onto the farm, if these animals have been in contact with other animals from other herds, for example, through an expo or at a show or at the sale barn, well, at that point, you have to watch these animals very closely for about 21 days and isolate them. For herds where we suspect that there is HPAI in the cattle, we have to take personal safety precautions for starters. Producers and employees who will handle these animals, as well as veterinarians and any other person who procures care and gives us care, that we have to take care to keep animals separate. Obviously, there's equipment disinfecting. There is milking sick cattle separately or last after the healthy cattle. And you want to make sure that all of the equipment is up to date and cleaned to avoid any bad suction that could lead to contamination of the next animal. We also suggest that we isolate sick cattle from the herd, and that we avoid housing multiple species together. When a number of species are kept together in the same area, in particular, if we're talking about birds or other, it's really important to apply biosecurity measures. They need to be high level, very solid. We know that transmission in the US it can happen between cows, and it can be from employees from cow farms who would have transmitted the virus mechanically from poultry farms. So it's really important to not forget this phenomenon. We also want to limit animal movements as much as possible within the farm. And if possible, we want to put in place biosecurity measures and look at sanitation on the farm. We also recommend that we not consume raw milk currently, given that we don't have enough data on that, and to not give raw milk to other animals on the farm, or at least to treat it before giving it as feed to cats, for example. So if you want to know more, I invite you to go to the CFIA external website, or to communicate with your head veterinarian, the chief veterinarian, provincial veterinarian.
Si on veut prévenir l'introduction du virus dans une ferme,
If we want to prevent the introduction of the virus on a farm, oh, I think we've seen this already. We'll go to the next slide. I think I'm saying twice the same thing. Sorry, that was a mistake on my part. Let's go to collecting samples. So, the guidelines that we are using on the web, private vets are responsible for sample collection if we think there's a virus present. So they can send the samples to a CAHSN laboratory. They can analyze these samples. Again, we're talking about the same labs who analyze samples from poultries during this H5N1. So if you want further information on the labs that have been approved, you can communicate with your district office, and the district can guide you when you'll contact them to also report any suspicious viruses. Now, in terms of sampling, we recommend to take samples at least 10 animals that have symptoms in the herd. Each animal, we're talking about raw milk samples, and to take up to 10 millimeters aseptically in sterile container in plastic with a cover where you can, for instance, screw on the cover and write and use the animal ID on that sample and write it down. And when we talk about an animal that is showing some signs, nasal swab can be used with a brush firmly both nostrils, brush firmly both nostrils, and you can use the UTM for travel. We're talking about one sterile sample for both nostrils of the animal, and we go fairly far, the 20 centimeters in there, and we have to get a good sample. And once that's done, and we have our sample in both nostrils, we put this in the UTM and we shake it slightly. Once it's done, we should take the liquid out and then you dispose of it. Oh, I'm sorry, a little technical problem here on my side. Shouldn't be long. All right, next slide. So next slide, please. Now, the CFIA's response to a suspect case. As I mentioned at the beginning of my presentation, the approach is different between the full response where we'll reduce, for instance, the number of animals and eliminate animals and do a fully disinfect the farm. It's not the goal right now. That's not what we planned on doing, to use such an approach when it comes to cows. But I must remind you that seeing as the data are coming and it's new on a daily basis, we get new data, we can't foresee what will be done in the future, and we must use a risk-based approach. So if the risks change, may it be when it comes to animal health or a risk to human beings, or the consequences when it comes to trading agreements, then it's possible that the response may change. But for now, CFIA will only collect basic information during when someone speaks to the district office, the location, what has happened, the history of the animal, what species are we talking about, why do they think there's this, that it might be HPAI, are there any dead birds on location. The CFIA could also share this information with the chief vets of provinces, because as we said, we're working in cooperation. We have epidemiologists nationwide that are working together to draft a questionnaire, a survey, which will be standardized to be used by every provinces. So now our staff would give advice when it comes to sampling and share information as to where to send these samples for analysis. So our main role, as I said, and I keep repeating, when we're talking right now about bovine, we offer support when it comes to diagnosis within our labs, and also in terms of producing reports internationally, because the reason why this HPAI is compulsory reporting for all species is because the World Health Organization requires that countries which see a new disease, must be shared with the World Health Organization because it's emerging. So this is why in Canada, the decision was taken from the start that all species we would declare these epidemics to follow our international obligation. So we work with various stakeholders, the industry, public health, provinces and territories to coordinate a national intervention, and we'll continue to reassess our position based on new data coming in, which may change the risk, as I said, when it comes to the risk both to trade, animals, and human beings. So when it comes to the next slide, please. We work closely also within the agency. We work with food safety and we work with public health. So we want to be reassuring when it comes to the general population, meaning there's no risk. Even after 3 years of after HPAI, there's no risk. And even internationally, after 20 years of this virus circulating in poultry, there's no evidence, scientific evidence, that shows that transmission took place by eating food or by water. Generally, avian flu, the main cause is when they had close contact with infected animals or an environment that is highly contaminated. So pasteurized milk in Canada, it's compulsory to pasteurize milk before milk can be sold. And it's a process that has shown its value, and it guarantees that dairy products remain safe and that we maintain its nutritional value. And in fact, the FDA in the US published the results of a new study showing that pasteurization remains efficient and effective, and it's good to deactivate the virus even when parts of the virus are detected in the samples. So next slide. So maybe in closing, there's additional measures that were taken by the government of Canada and announced last week. One of them is that there's some requirements, new ones, when it comes to import dairy cattle coming from the States. So we must have a negative result these cows must test negative before they're imported into Canada, and we have to watch this avian flu. Screening tests, retail milk to find viral particle also are taking place right now, and the first results are good up to now. All the results are negative in fluid milk, and this will announce officially on our website. But there, I'm giving you this as a scoop. And also, voluntary screening tests for cows not showing any clinical signs will facilitate this avenue to try to help the industry in its efforts to heighten their biosecurity. A producer who would like to introduce an animal to his or her farm would have the option to test that lactating cow to make sure it tests negative. The last two slides are links where you'll find most of the information available in Canada. So if you want further information, the last two slides are web links to obtain additional information. So I'll stop here and I'm available to answer your questions.
Merci, Jen. Donc,
thank you. I'll switch to English once again. So select the language of your choice.
Sélection les diapositives
and the slides also.
So I'm going to change back to English for our final two speakers who will be combining on their presentation. So to end off the webinar, I'm pleased to introduce Dr. Rob Tremblay, who is a veterinary consultant for the Dairy Farmers of Canada. He was a founding member of the CQM Technical Committee, the forerunner of the Food Safety Subcommittee for ProAction. He is a specialist in food animal medicine, with a specific interest in the prevention and control of infectious diseases. And joining him will be Cheryl Schroeder. Cheryl is currently the Senior Advisor for Animal Health for Dairy Farmers of Canada. She is an animal science expert managing the biosecurity module and emergency management. Cheryl has spent 10 years with the National Pro-Action Program, where she worked very closely with farmers and provincial associations. Cheryl's extensive history with dairy farming started on her family's dairy farm in Manitoba. Cheryl worked with Dairy Farmers of Manitoba for 15 years in a producer relations title that involved introducing the Canadian Quality Milk Program to Manitoba. So taking us home, please welcome Cheryl and Rob.
Thanks, Murray. I will start. So thank you for everyone that came today. I will introduce a little bit of what DFC's been doing, and Rob will come with the details following that. So I'd like to follow up on the conversation that Cathy had on partnerships. We have been working very closely with the CFIA, so Cathy and Jen and that team and I have been in constant communication since this started in the end of March, or when it became more evident on our side. We really depend on the partnership that they have with the CVOs, as consistent messaging and consistent action across the country is something that we strive for and encourage as ourselves. Our messaging that we send to our provinces is done in collaboration with the CFIA, so they make sure that everything is matching what they're communicating with their CVOs, etc. The provinces would then send all of our comms out to the farmers, and they have various techniques on doing that. We've also made it very clear to all of those that we communicate with, our provinces, our farmers, that this is a developing situation and that things can change. So Rob, if you want to take it from here, that would be awesome.
Thanks, Cheryl, and thanks to the organizers for giving us an opportunity to talk. May I have the next slide, please? What I'm going to lead you through is a chronology of the communications that dairy farmers would have been exposed to since this situation started. So on March the 25th, the US announced that highly pathogenic avian influenza was detected in milk from several cows in a pharyngeal swab. And so then that cleared up a bit of a mystery as to what had been causing the clinical syndrome that had been discussed before this identification had taken place. On the 27th of March, the DFC then released information advising dairy farmers that the detection had been made and making some general recommendations for biosecurity, but specific recommendations in relation to protecting the herd from wild birds in case the source was wild birds, as well as recommendations to be concerned or to develop biosecurity protocols for the introduction of new cows to the herd, and then for the control of movement of people coming onto the farm. In addition, the farmers were advised to contact their veterinarian should they observe the signs, and the signs that were related to the dairy farmers, and advised also about the possible risk that milk could represent to animals on the farm and to people on the farm, and finally how to deal with dead birds if dead birds were found on the farm. Next slide, please. This was quite a rapidly developing situation at the end of March, and so then a more detailed press release outlining biosecurity practices was released on the 31st. And in that, the biosecurity practices were really grouped into two categories. One were biosecurity practices that would help the farm exclude high path AI if it was at risk of coming onto the farm. And it was focused on the risk maybe of animals or people coming from the US in addition to birds. And then there were biosecurity recommendations that would be suggested should high-path AI be suspected in the herd or confirmed in the herd, to prevent the further transmission in the herd, and to again address the risk to human safety that the disease might represent. Next slide, please. There were additional recommendations sent out on April the 9th because it was recognized that people move from farm to farm quite frequently in dairy, either because they're providing services to the dairies or they're delivering materials that the dairies need. So there was a list of specific biosecurity practices for service providers to the dairies, in addition to the biosecurity practices that had been outlined on the 31st of March. And at that time, the DFC prepared to host 2 webinars, one in English and one in French, for dairy farmers across the country. And the webinars consisted of 2 parts. One was a description of the clinical features of HPAI in dairy herds and what we knew about it at that point. And then the second was a review of the biosecurity recommendations for HPAI, again separated into how could you protect your herd from being potentially exposed to the influenza virus, and then what could you do if the virus was suspected or identified on the herd. In addition, the good thing about a webinar is that it gave farmers an opportunity to ask questions, and so that it became a bit of a two-way conversation. Previous to that, everything pretty much had been flowing out. Next slide, please. So on the 18th of April, so the following week, the CFIA released the guidance to private veterinarians on HPAI in cattle. And so the following day, there was communications sent out to the provincial dairy boards, providing that additional information from the CFIA, and providing the new information that was available in the United States with regard to new knowledge about the disease itself, as well as the further distribution of the virus and infection in herds. And then at this time, it had become apparent that cow movement was probably a bigger risk than some other types of movement. And even though the risk from wildlife, from birds, for example, couldn't be excluded, but there was more of a focus on movement of cattle and awareness of the potential role of wildlife, and less emphasis on other aspects of biosecurity as far as a herd risk was concerned. Next slide, please. On the 24th, so late in that week, the U.S. issued its federal order requiring a negative PCR test for HPAI in milk for animals with interstate movement, which became effective on Monday, April 29th. And on May the 1st, the CFIA announced changes to the import requirements for breeding cattle imported from the US to Canada, and made with the application retroactive to April 29th, and dairy farmers were advised of that. The next slide, please. These are the requirements, and so the focus has been on the testing, but it's important to realize that in addition, animals presented at the border must be clinically normal for 60 days prior to the entry, even with a negative test, and they have to come from herds that had not had clinical disease within the last 60 days. So it's an extensive health requirement, and dairy farmers were made aware of that. And that is more or less the situation that we are right now. Next slide, please. Cheryl.
So one thing that we're very aware of at Dairy Farmers of Canada, and try to promote and support in all the ways that we can, next slide please, is the concept of mental health and mental illness and the stress that any of these situations put on people. Here are some lists of some high-level resources. The provinces all have extra, your individual provinces likely have provincial supports, but this is something that we wanted to make sure everyone was aware of so that A, you know where to send a farmer if you think they need help, and B, you could use these resources yourself if that became something that was required. So again, this is something that we take very serious, and we like to include in situations that are unusually stressful and unusual for farmers. So Rob, I think that was it.
Yeah, thank you, Cheryl. Back to you, Murray.
Thank you very much, Rob and Cheryl. So that leaves us about 20 minutes for the Q&A. That's all our speakers. So big thank you to all the speakers for their presentations, for their information. If you have been paying attention to the Q&A, Carol, who's a pro webinar giver by now, I would say, has been answering a lot of questions, typing in the answers. So if you check the answered section, or the your question section should also be at the top of that tab. You can read the answer to the question if she has given it. We will also capture again the answers to all these questions for dissemination later on. So I'll just go through the questions list. The first question I believe is going to be for Jen. Are you aware of any talk within USDA CFIA to require serological testing for importation of feeder cattle into Canada or into the US?
I'm not aware of any discussion on these, although I must say I'm part of the group that handles the disease control, not the import-export negotiations. So there might be something on the go that I'm not aware of. But right now, the beef situation is that so far, it hasn't been detected in the United States either, and they've done some testing and everything was negative. So not that it cannot happen because a cow is a cow, but for now, I think we're concentrating our effort on the dairy cattle.
Thanks, Jen. Maybe a question for Carol, but somebody could jump in. Are there concerns about dumping milk on the pasture and that reinfecting the wild bird population, thus amplifying the disease?
It's absolutely a concern. I'm not sure that it's you know, that we have any other options. I think that this is simply a massive situation. And so, yes, concern, it's a possible pathway. We'd love to see manure being spread away from poultry facilities. We are unclear as to how to prevent infection of wild birds from extensively distributed manure.
Thanks, Carol. And maybe the next question for you too, with the question on the vaccines. Since the udder seems to be the site of replication, systemic vaccination, could it be less efficient considering the barrier of the udder versus other species?
It's a good question, but I guess I'm not clear as to how we would deliver, or we might deliver vaccines, right? So vaccines could also be delivered intramammary. And, you know, we do know that there is IgA in the mammary gland, and that IgA can be protective for an infectious type of mastitis. So that is potentially an option. I think in addition, we could be looking at a systemic and an intramammary infusion. I really don't know what it would be at this point. We just have the preliminary information about pathogenesis, and only from a few cows. So it's really, really very limited what we know at this point. But I think that this is a good time to say we as a human species really have a lot of creativity here, and we shouldn't limit ourselves to that which we have done before. We should really think about what is possible and address the real problems that are facing us and, collectively. So.
Thanks, Carol. That might answer a few of the other questions about incentive to report the disease. Another one possibly for you, Carol. In the prairies, there's concern about wild pig population. If they were to become infected, would they facilitate AI mutations, making the virus more dangerous to ruminants, wild and domestic, humans, etc.? Yeah.
I have no idea. But I think the more species that are infected, the worse the situation is. Simply, I just have no idea. But I think, to me, the things that really bother me, and we're talking a lot about agricultural species here, but I'm very bothered by cats. And, as probably half of us have cats roaming around us right now during this webinar, and the ability for a cat to be in an ag situation and also to be in our homes, that has me frightened. And I think the other piece is they fall between the cracks. They're not an ag animal, so we're not sampling them as an ag animal. They, our small animal practitioners here in the US are not sampling at all. So I think that's a real potential weakness of our system. Listen, I'm going to go plug in my computer because it's about to die. So.
Okay. Thanks, Carol. Yeah, it really highlights that this is a multi-species issue, these influenza viruses. And for the veterinarians on the call, it pays to involve your whole team. If you work in a mixed animal clinic, make sure your whole team is up to date on the information that's being provided, because it's not just cows at this point in time. The next couple questions I'll combine together. I think they're going to be for Jen around the decision tool. Is that tool available to the public?
Hi, sorry.
That's right.
I'm having some wideband issue. Yes, the decision analysis tool is available on our external website. So if you follow the path until terrestrial animal disease, you should find it one click before or after. So yeah, it's easily accessible.
All right. Thanks, Dan. And then a couple questions about the testing. The veterinary fee, the veterinary call fee, is that to be paid by the producer? And then the charge for lab sample testing, who covers the costs? I guess where does CFIA cover versus the cover of the veterinarian and the producer?
Okay, so I'll keep my camera off to make sure I'm not losing you. The vet fees, that's on the producer, but the test fees, that's on CFIA. So that's part of same as we're doing for poultry. It goes through the same network, lab network, and it's the same protocol. So yes, those fees are covered by CFIA.
Thanks, Jen. Another question for you. Does the CFIA district veterinarian need to pre-approve the sampling and submission prior to submission to the laboratory by a veterinarian?
Well, kind of, because you need to report a suspicion, and there's going to be a discussion between the district veterinarian and the practitioner. I mean, we rely on you because you're the one in the field that knows these animals, that knows mastitis and those other symptoms that are pretty vague and that are not pathognomonic necessarily. So we rely on you. So I don't expect that a district veterinarian would say, no, we're not sending that sample. But there's for sure, we are there. We are here to help. Our staff have received the proper guidance. And they will gather the necessary information, and they will help you out.
Thanks, Jen. Yeah, everyone's lined up to help people out, so don't hesitate to reach out to anyone when you need to. The decision analysis tool was shared in the Q&A, so I just put that in the chat out to everyone. So you should be able to see a link now in the chat to CFIA decision analysis tool so that you can access it. Another question for Jen or another CFIA representative. Is the CFIA worried that Canada will experience a similar hesitance to what is seen in the US to report based on lack of government support and vague information about what will happen to a positive herd?
That's a good question, which is almost more political than disease control per se. I think that Canadians are different than Americans, so that's one thing. The difference here is that it's not only a test result that is reportable, it's the suspicion with clinical signs. And that was there, I mean, it's been there all the time. Even before it started in the United States, we had that in place based on our Health Animal Act. I mean, we never know how people are going to react. So I don't have a crystal ball. I hope that I came here to show that we're here to help. We know how hard this is on the producers, and that's why we will rely on industry as much as possible to do those movement controls, so we don't have to go and start putting regulatory controls on farms as much as possible. But as I said, it's a constantly evolving situation, and we have to reassess based on the risk, and that's the approach we're taking. But the more awareness there's going to be out there with the producers and the veterinarians, and the more trust I hope there is that they can report without too much fear. I think that's the best for everybody, because the sooner we know, the quicker we can react, and someone can say, okay, I'm keeping my herd closed for like 2 weeks, Fred was mentioning earlier, and then I'm not giving that disease to anyone, and I'm not bringing any new animals in to jeopardize my herd if I don't have it. So I think that's the message that we want out, is that let's try to work all together to stop this if we find one. But the sooner we will detect it, the better, because if we don't detect it, it's gonna spread.
Yes, thanks, Jen. I agree, and maybe I'll call on Cheryl or Rob too to comment. But the requirements under ProAction do require producers to report animal health events and abnormal milk and anything that may be associated with influenza A virus. And so the incentive to follow ProAction is mandatory for dairy producers on the industry side. I don't know, if anything you want to add to that, Cheryl?
Well, it's something that we're pushing really hard to call their vet if they see anything suspicious. And we're really trying to support that through both the CFIA messaging and ours.
This is Carol. If I could address that as well. I think one of the ways that, or one of the reasons why this is so difficult in the United States is that you have dairymen who do not understand, and that their herds are not going to be depopulated. They've seen, depopulation and stamping out apply to poultry farms. It's been very, very confusing. There has to be a plan in place, and people have to understand what's going to happen to them. In addition, you cannot test somebody. This is what happened to chickens with Salmonella enteritidis in the United States. You cannot test somebody. You put them in a box of being positive. If they have no way to get out of that box, they're not going to go into the box. So there has to be a plan as to how you evolve, and how everybody gets, because the consumer liability, the liability potential with your workers, the concerns, People perceive knowing as risk. Knowing actually reduces risk, but they don't perceive it that way. So I think if I were to give you any advice that you're not asking for, it would be to have a plan as to what is going to happen and communicate that clearly, because you know, then people will be able to understand the risk of detection, and that the risk of detection is not worse than the risk of not knowing.
Yes, thanks, Carol. Just a couple more questions. I'll pose the next one and then I can take a stab at it from what I've heard from the ABP. But since clinical signs are not specific, should we include detection of bovine influenza A virus in routine testing? Anyone want to jump on that one? Or you want me to go ahead?
I'm sorry, are you asking me, or who are you asking?
Anyone who wants to have an opinion on that one, because I haven't seen an answer to that question yet. But routine testing of influenza A.
I say that's yours, Murray.
Okay. So there is a network within one of the CAS networks that is working on an expanded case definition that may include some more targeted testing beyond the regulatory CFIA approach. So for that, and I know AEBP is working on similar things as well. So for that, I would stay tuned. I guess my recommendation for the time being would be, if you have suspicion of high path avian influenza based on the case definitions that are out there, I would test. And then beyond that, you could test based on high risk or your risk factors for individual herds. And we'll have some more information on that a little later on. Go ahead, Rob.
I believe the communication from the CFIA recently permitted the testing of clinically healthy cows. And so that is at least a temporary measure that people, if people wanted to take advantage of that, then they could take advantage of that.
Jen, did you have a comment?
Well, just to say that there's some more guidance that will be coming up. It will be an update to the current guidance available on the website, and it will address the recent statement on that voluntary testing of non-clinical lactating dairy cows.
Yes, stay tuned. Again, if anybody wants to take a stab at this one, a significant number of dairy calves are imported from the US into Canada. From the presentations this evening, that class of stock poses very limited or perhaps zero risk of being a source of virus. Would that be a correct interpretation? Or what is the risk from young calves? So again, I can respond to that based on what I've been hearing. I would agree that the correct interpretation would be very limited risk, but at this point in time, I would be very hesitant to say zero risk. As Fred said, just today, we were made aware of seroconversion in heifers. We initially, hadn't really been considering heifers, and so something similar could be the same in calves. Especially calves fed waste milk, which I'll try to answer another question about how common is it to feed unpasteurized milk to calves. It's less common now than it used to be, but still a fairly common practice. Unpasteurized, like waste milk, is a pretty a cheap source of nutrition for raising bull calves or raising bob calves. And not every producer has pasteurization or heat treatment facilities on their farm to feed to pasteurize all their milk. So unpasteurized waste milk is still a fairly common practice, but becoming less and less over time, which would make calves a potential risk for the virus as well. What are the general, Carol's answering that question. I don't know what she put in, but general PPE practices, and again, on the AABP working group call that we just had, by far and away, the best thing you can do is wear gloves. So I think that now is a really good time to really up our biosecurity game. Now is not the time to cut corners when it comes to changing coveralls, disinfecting boots, and being clean on premises. But for producers and veterinarians, the best thing you can do is wear gloves. They referred to a study that had showed that just wearing gloves alone was very good. They recommended masks and eye protection and stuff like that. But at the very least, gloves are very, very important, and they should be worn on the dairies, especially by milkers and veterinarians at the same as well.
And Marie, if I could add
Yes.
about the gloves, not only gloves are important for your own personal safety, but they are also helping with reducing the easiness of transmitting the virus, because it's easier to rinse your hands and wash your hands with gloves. The virus will adhere less at the glove than at the skin. So there's also that component to take into consideration.
Yes, thanks, Jen. Martin's asking, what would be the rate of acidification of milk necessary to inactivate the virus and allow its elimination? I don't think Fred had an answer to that one. Maybe Carol or Jen has an idea.
I don't have an answer. I can just say that our science branch is actually doing a literature review on the different means of inactivating the virus in milk, because we want to be able to provide guidance regarding what are we going to do with the milk from these affected animals. So either if it's to be discarded or if it's to be fed to other animals on the farm, we need to know, we need to be able to provide something. So again, stay tuned for that one too.
Acidification is actually, it has to be pretty darn low. And I think with milk, then you're really talking about, kind of cheese type stuff. So I think I'm going to put in the chat too about some the secure poultry supply plan. Even though it's for poultry, we have huge literature reviews associated with that, and so when you look them up, you can get information on high path AI transmission in bugs, high path AI, how much is in rodents, how so it's got, I don't know, it's 200 pages of lit review. So I'm going to put that in the chat. You can I'll put in the broilers to market, even though that one just because it's really new. But that, and somebody asked also about like inactivation and stuff. And so we've got, I think it's Appendix 1, Table 4 is all the different media types that have been tested. Feathers, stainless steel surfaces, all of those types, and how long the virus lasts on those types of surfaces. So if that's helpful.
Always helpful. We'll try to do the last. So there's been a couple questions about a plan, and Jen can comment, but CFIA is working with the provinces on those planned responses, right? So the provinces are the other party that's involved in those, each individual province, and so they are developing their plan. They will communicate the plan under CFIA's guidance. With that, so those plans will be coming again. Another stay tuned, but they will be coming in due time.
Exactly. And I mean, for now, it's biosecurity, limit movements. If you suspect it, report it, test it, and that's really the basics.
Yeah, and so that answers the last question. I mean, veterinarians should be the champions of biosecurity, now more than ever. We should make sure that our socks are pulled up on that and make sure that we're doing a good job and make sure that the recommendations we're giving are sound for the benefit of the producers that we're serving. Veterinarians do the ProAction biosecurity module with their producers. That's mandatory for ProAction. And there's a reason why we all go through that. So veterinarians should be champions of biosecurity. And with that, I'm going to just pop up one final time if there's no other comments. Our sponsor slide, because I do want to acknowledge everyone who went through, participated in getting this webinar up and running and out to all of our veterinarians and all of our members across the country. I want to say a big thank you again to our speakers, to Jen and Carol, Rob and Cheryl, and then to Fred as well for their participation, their willingness to join this, to speak at this webinar very, very last minute. And a big thank you to the CABV for helping CAS get the ball rolling on this, and for all the associations, the regional networks that you can see on your screen. A big thank you to all of them. If there's no other final comments, let's check one more thing in the chat. Okay, Carol posted the link there. So if there's no other final comments, I think we'll let everyone go. Thanks everyone who stuck it out. We're only 3 minutes late, so lots of good discussion on this. So thank you to everyone who came out and participated, asked questions, and went late into the evening, especially here on the East Coast, for this webinar. A big thank you. We'll get the recording out as soon as we can, and I hope everybody has a great night and a good upcoming weekend.
Thank you, everyone. Bonne
Bye.
soirée.